Hi, it's Dr. Centeno, and this is the How to Rehab from CCI Part 3, where we take those rehab strategies you learned in Part 2 and we match them to your functional level. And this is the video for very limited patients. So I want you to like, comment, share, and subscribe because that's how we get this content out to more patients like you. Now, this is a 3-part series. The first is threading the needle. The second is rehab strategies. And the third is matching your functional level, and that's where we are. And this is for patients who are very limited. So let's talk a little bit about the general concepts here first. So the first is climbing out of the hole, right? If you are functional, it's very easy to rehab. If you are bedbound, it's going to be much harder, take much longer. And this is for that second level of very limited patients. So take whatever level of disability, in this case, very limited patient that you have, and we apply a rehab strategy. Now, if the symptoms are manageable, then you can start increasing the difficulty of that strategy. But if the symptoms aren't manageable, then you may have to back off a little bit and try again. And if you can't do it at all, then you might need something like a PICL or posterior procedure. Now, if you can increase the difficulty of the rehab, then you can obviously get to the next functional level, which is great. That's really what we want here. And again, this is for very limited patients. Basically, the definition there is that you can spend the whole day upright, but you need to lay down several times a day for good chunks of time. So that's kind of the functional level that we're talking about here. So the first is ligament instability, right? In the last video for bedbound patients, we talked about using a collar to get out of bed. And for patients in this category, they've kind of usually they've figured that out by themselves, or maybe someone told them that. And so they're using a collar. And here we want now to get to the point where they use that collar a little bit less each day. Because remember, in this level, the goal is to begin to gain low-level strength and endurance. And so we want you to start weaning out of that collar. If you don't use a collar at all, then maybe you can try using one, but only use it as little as possible for things like riding in a car or traveling. Now, what if you can't progress past here? You can't get out of the collar at all, no matter how hard you try. Then again, you might need an intervention like a PICL or a posterior injection. Now, muscular instability is important, right? Because we have ligament instability. That's what CCI is. But those patients also notice that they have problems with muscular endurance, for example. We see atrophy of the muscles in these patients. So the muscles need to get built up. Now, in the last level, bedbound, we talked about trying some simple range of motion exercises while you were lying in bed. Here, you start trying these while you're seated. So that would be extension, flexion, rotation, a little bit of lateral bending to either side. Now, you might have specific types of range of motion that seem to aggravate your symptoms, right? For some patients, it's flexion. For some patients, extension. For others, rotation. So you might have to not do that one as much in order to thread that needle, like you learned about in the first video. If you haven't seen that, go back and watch the first video in this series. So try to do this, and this will just very gently start to increase your strength. Now, if you can't do it at all, and there's just no way, then again, stop, and you might need an intervention, something like a posterior injection or PICL. Next are symptomatic structures, and we learned in the second video series that symptomatic structures were things like facet joints in the neck, nerves, blood vessels that get irritated, impinged, etc. So A or a nuclear chiropractic can be a big help to many patients. They can help provide some temporary relief or maybe even more permanent relief if you have very minor instability. Another thing to try is see if using pressure on the suboccipital muscles in the back of your skull can help. And I think you'll fall into one or two categories there. One category would be you can massage those suboccipital muscles, and that feels pretty good. That's a strategy you can use. a solid one. You could also put ice back there, right? That's another thing you can try. If you can't tolerate the pressure, then consider putting ice back here, because that can also help. Now, if you can't tolerate anything like that, because it just makes you worse, then again, you might need an intervention. So with those nerves specifically, you might need to go ahead and try a platelet growth factor hydrodissection, a very specific ultrasound guided one to help those nerves. Or you might need a posterior injection or a PICL. Another component of any program is going to be proprioception or position sense. And we have exercises online where you can actually use a little laser pointer and you can start to work on proprioception. This also starts to work on strength. So try the neck range of motion exercises first. If those are pretty easy to do, then you can try these at-home exercises. And these are structured level 1, 2, 3, 4. Now, go very, very slow. If this increases your symptoms beyond what you can manage, then stop. Again, if you can't do this at all, then you might need an intervention like a posterior injection or a PICL. Loss of curve is a big problem for a lot of our CCI patients. And so I was talking about this towel test, right? You take a small little towel, the size of a hand towel, and you roll it up, experiment with that thickness, put it right underneath your neck as shown in the upper picture here, and see if it reduces your symptoms. It may reduce your symptoms, in which case you can continue to do it, experiment with maybe making the size of the towel a little bigger. If you can't tolerate this at all, no matter what, then obviously stop, and you might need an intervention as we've been talking about, PICL, posterior injections to tolerate it, etc. But if you can tolerate it and it feels really good to you and it feels right, then you might consider finding a CBP provider to start increasing that curve at idealspine.com. Then posture. Posture is keeping your head over your neck, over your upper back, all of that good stuff. And again, you can do some simple things while you're lying down. So that couple of times during the day that you have to lie down, you can do things like take a rolled up towel, more like a bath towel or a larger towel, obviously, than a hand towel, and put it right under your upper back and spine there. Experiment with the size of the towel, but just lay there and let your chest open up. You can also focus on doing an adductor in front of your hip stretch, as shown in the second picture down. And you can start to work on the glute bridges, as shown in the lower picture off to the right. Now, if this causes your symptoms to get worse, then stop. But if this is all pretty easy for you to do, then you might consider some online postural work, either through Healthy Posture Club, we work with them a lot, or Egoscue, we worked with them as well. And those are a little bit more challenging, and they're also guided. So one thing to consider is if you just can't seem to tolerate any of the stuff you can do on your own, then maybe go to Healthy Posture Club, for example, and get a physical therapist to try to work with you to see if it's possible to modify those to your specific functional level and what it is you can do. So in summary, if you're in this very limited functional level and you've got to lay down several times a day to control your symptoms, there are things that you can do. And just realize that starting at a very low functional level, it may take a long time to rehab. That's okay. And if anything makes you worse, then stop. And if you can't advance, then we may need to come in with orthobiologic interventions to try to help you. So again, I want you to like, comment, share, and subscribe, because that's how we get this information out to more patients like you. And again, hang in there. One way or the other, you can move forward. That's possible. So I want to thank you for watching and have a great day.